I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today we're going to talk about what to expect with egg freezing. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist. I've been helping people build their families, freeze eggs, preserve their fertility for over 15 years. And today I want you to learn what to expect with egg freezing. I educate about egg freezing a lot. It is an incredible opportunity. It's important to be educated and to really have a transparent and informative conversation with a reproductive endocrinologist about whether it's right for you or not. I have other educational videos here on YouTube that talk more about who should consider egg freezing, a little bit of history of egg freezing so you kind of understand the technology. I also have a video on how to choose a clinic for egg freezing. This particular video is on what to expect for your egg freezing cycle. Whether you have decided to do a cycle and freeze your eggs or whether you're still educating and learning, you're going to learn about what to expect for the cycle. So egg freezing is like an IVF cycle with a pause in the middle. And what I mean is the whole concept is to get eggs out of the body and freeze them. And that's what we do with IVF. IVF is a fertility treatment. It's been around for over 40 years. And in that process, you are stimulating the ovaries to recruit multiple eggs, extracting the eggs from the body. In the lab, in vitro fertilization, you have the eggs and the sperm, you help them fertilize, watch embryos grow, and then you choose the best embryo or embryos to transfer the embryo into the uterus with a little catheter through the cervix, and you hope for pregnancy. And so IVF has been an incredible treatment for lots of different fertility issues: tubal disease, low sperm counts, endometriosis, unexplained infertility. IVF is amazing. And you typically think about it for people who are not able to get pregnant on their own. You think about it, it's treating a fertility issue. Egg freezing is using IVF, that first part, to extract the eggs and freeze them to be used at a later time. And there's lots of different reasons that people will freeze their eggs, but what to expect is kind of like what you would expect for an IVF cycle, because a lot of the preparation and testing and the shots and the egg retrieval are the same. They are the same. It's just that you freeze the eggs, and if you want to use them, then later you create embryos with sperm and transfer an embryo and get pregnant. So what to expect is you should absolutely have a consult with a reproductive endocrinologist, a fertility doctor like me, who can go through your test results. You should do ovarian reserve testing, like an AMH at a minimum. That's anti-Müllerian hormone. It gives you a window into the number of eggs that are up for grabs each month. You should have a consult and go over your test results, your age, your personal situation, your family building goals to really decide whether egg freezing is right for you. And think about your goal for number of eggs too. The older the eggs are, the more eggs we need to help increase the chances of success when we use them in the future, because fertility declines with age. And so preparing and having that consult and having really good expectations beforehand is really important. Then it's a lot of learning. So it is, going through an egg freezing cycle, you're sort of expected to be not only a patient, but a nurse, administering medications to yourself, a pharmacist, you find yourself like mixing medications, a social worker trying to kind of fit all of this in, a financial planning counselor trying to figure out, cost and hopefully insurance coverage if at all possible. Part of knowing what to expect for egg freezing is understanding what the process is going to be like. So there's typically preparation, and then it's actually doing the stimulation, and it ends in the egg retrieval. What I mean by preparation is learning, education, getting the medications, understanding how to use the medications, and kind of working with your menstrual cycle and kind of leading into stimulation. Very often, you'll start with birth control pills. Birth control pills you can often take for a couple of weeks to kind of lead into the stimulation phase of the cycle. It's not a part of every clinic. It's not a part of every protocol, but just don't be surprised if your clinic recommends that for you. If you use birth control pills to lead in, you'll stop the birth control pills. and then come in for a little checkup. We want to, before you start the shots, we want to make sure the ovaries look ready and that everything looks perfect. We call this a suppression check. It's an ultrasound and blood work to make sure those ovaries are quiet and ready. And if everything looks good, then you start taking the shots. The shots are gonadotropins. They are subcutaneous shots. They go right underneath the skin. You typically take about 2 or 3 subcutaneous shots a day. You learn how to give them to yourself, and you can do this. I have a YouTube video on mastering subcutaneous shots, so check that video out to learn a little bit more about that process. We see you for about 4 visits during those 2 weeks leading up to the egg retrieval. It's that visit, that suppression check before you start the stimulation medication, and then it ends with the egg retrieval. And in between, we see you for about 2, maybe 3 checkup visits. These checkup visits are watching the response of your ovaries to this stimulation medication. So egg freezing cycle, IVF cycle, it's basically all like a zooped up menstrual cycle. So in a menstrual cycle, your ovaries take about 2 weeks to mature and get an egg ready. And then you ovulate, and then 2 weeks later, you get a period. So ovarian stimulation, whether it's for egg freezing or a whole IVF cycle, you are recruiting those eggs. You're giving your ovaries gonadotropins, the same thing that your body makes each month, but just at a higher dose, so that you can recruit multiple eggs. And it takes about 2 weeks. And we're making sure that your ovaries are ready for the egg retrieval. And we do that with ultrasounds and with blood tests, because you can't ever see eggs on ultrasound. They're just a single cell, but you can see follicles that are developing. And as the eggs mature, the follicles get bigger and bigger. And so you can actually see. One of the coolest things about egg freezing cycle is you get to really learn more about your body and your ovaries, and you get to see your uterus, and you just learn so much more than any other part, certainly not health class, right, in medical school or high school. So that's one really cool part about this. So when you come in for these checkup visits, you're doing an ultrasound to check on the size of the follicles. You're doing blood work to make sure estrogen is coming from the ovaries. It's a signal of the eggs are getting mature. And we decide when to do one last shot, which is called the trigger shot, that triggers the final maturation of the eggs and then allows the eggs to mature and come out easily at the egg retrieval. So you do the trigger shot, and typically about 36 hours later, you do the egg retrieval. The egg retrieval is typically done in the morning in our clinic, and you want to plan for a relaxing day that day. I highly recommend getting a ride to the clinic. You're probably going to have anesthesia that makes you fully asleep, and you want a friend, a trusted adult to get you home to your place and your comfy couch afterwards. The egg retrieval is actually done vaginally. So there's no incisions on your belly. There's no stitches. Basically, let me show you. This is Uni, my stuffed uterus. So eggs are inside the ovaries. And I know we draw them kind of out like this in anatomy books, but they're actually sitting down here near the cervix. And this is the top of the vagina. So when we do an egg retrieval, there's an ultrasound sitting in the vagina. And there's a little needle at the end of that ultrasound that goes through the upper wall of the vagina, kind of next to the cervix, and goes right into the ovary where the follicles are that have the eggs. And we stick the needle into the ovary and into each follicle, and we drain the fluid in order to get each egg. So it's kind of one puncture on one side, go into this ovary, drain all the follicles, get all the eggs, and then the same thing, puncture on this side to get into this ovary. So again, I know Uni's ovaries are way up here, but really they're sitting down here, kind of close to the top of the vagina. So it's all done under direct visualization, under a transvaginal ultrasound. And there's just a little needle at the end of that ultrasound that's just going through the upper wall of the vagina into the ovaries to get to those eggs. And you are typically asleep. You get an IV and you are totally asleep. It takes about 15, maybe 20 minutes, and you wake up pretty quickly. And as long as you are feeling well, feeling good, you go home and just rest and relax the rest of the day. You do not want to have any commitments the day of your egg retrieval. You just want to pamper yourself and rest and relax. I have had people who feel great after the egg retrieval, and they tell me later that they went hiking or, walking around Seattle because they were so excited to be here, because I have patients that come from all over. And I'm like, oh my gosh, because really, we just put a needle into the ovaries and you need to rest. Like, we need to have those puncture areas clot. So rest and just take a day off. Line up some fun, binge Netflix, whatever shows are right for you, but just make sure you rest and relax. You should not work the day of your retrieval. A lot of people go back to work the day after their retrieval. If you can take another day off, that's fantastic. It's all about self-care. And you just don't know how you're going to feel through the cycle. So as far as what to expect and side effects, some people have light headaches when they start the shots. A lot of people, as they get closer to the egg retrieval, will have bloating, fullness. The ovaries are getting bigger. There's fluid shifts. You're retaining water. It's kind of water weight. Some people will gain a few pounds in this, but it's all temporary. After the egg retrieval, about 5 to 10 days later, you should get your own period. That's finishing the cycle. So stimulation, egg recruitment, shots, getting ready. The retrieval is like ovulation. And then you're done. We've got the eggs, we freeze them. And then you give us a call about 5 to 10 days later to tell us you got a period. And that is finishing the cycle. By the time you get your period, all the hormone levels are back to normal. Typically, the ovaries are back to their normal size. And if you had bloating, you're feeling a lot better. One important risk factor for anyone that does an egg retrieval, whether it's for egg freezing or IVF, is something called ovarian hyperstimulation syndrome, or OHSS. It's important to talk to your doctor about. It's very rare. Everybody has a little bit of hyperstimulation because we are trying to get multiple eggs, but some people can have significant bloating, discomfort, and really feel uncomfortable after their egg retrieval. And so it's important to talk to your doctor beforehand. Am I at risk of OHSS? If that happens, what would we do to take care of me? And just kind of really go through the procedure and risks and questions and expectations. Sometimes people have constipation after the egg retrieval. That comes from high levels of progesterone. Sometimes people are taking pain medication after their egg retrieval. People aren't moving as much. They might not be as hydrated. It's kind of a setup for constipation. So if you have a tendency towards that, kind of talk to your doctor about, should you take stool softeners? Is there anything to look out for? Because if you are constipated, it can just make the recovery a lot more uncomfortable. The other thing that people don't think about, or sometimes the clinic doesn't remind people of, is that the period after the egg retrieval can be really heavy. So because your estrogen levels are higher and you're recruiting more eggs, that can make the uterine lining a lot thicker. And so when you actually get that period right after the egg retrieval, it can be heavier and crampier than your typical period. That might not happen to you, but if it does, it's important to just say, oh yeah, like I knew to expect this. If you're concerned, call your clinic, ask questions, but I just want you to know that that is a possibility. You should absolutely have a return visit with your doctor after your egg freezing cycle to go over the results. They should make sure that you're feeling okay and that your recovery is okay. And you should talk to them about the number of eggs that are frozen and what that means. A lot of people end up doing more than one egg retrieval because the more eggs that you freeze, the better opportunities in the future. That is not the case for everyone. It is a very personal decision, but it's important not just to freeze your eggs and kind of walk away and not have that closure and kind of discussion about like, okay, what does this mean for me in the future? An excellent resource to learn more about egg freezing is a book written by two of my favorite people in the world, Dr. Julie Lamb. She and I have been partners at Pacific Northwest Fertility, for over 10 years, since 2009, 2010. And then this incredible nurse, Emily Gray, she is fantastic. The two of them wrote this wonderful, informative book on egg freezing. It's not overwhelming. It's not super, dense, but it is packed with information, how to prepare for your egg freezing cycle, what to expect, what questions to ask, how to find a clinic. So I know that YouTube videos are great and I hope you're learning a ton, but if you want more detail, this this is a really great resource. I hope this was a helpful video. I think if you're getting ready to freeze your eggs and you're learning more, you're considering this, it is a really amazing opportunity, but it's important to educate yourself and learn more as you're trying to make this really important decision for you. Like this video if you learned something, comment with questions that you have. I am here to help. Subscribe to this channel so you can keep learning and stick around for more videos.